It's not just a scar, it's something more complex, something that requires a deeper understanding. Hello, my popaholics. I'm Dr. Sandra Lee, and I'm here to shed some light on a common skin condition. And today we're talking about keloids, those raised, often noticeable scars that can appear after an injury. Something I see all the time in my clinic. Patients often come in concerned about these unusual formations on their skin. Many think a keloid is just a scar gone wild, an exaggerated version of the normal healing process. But it's actually an overgrowth of scar tissue, a benign yet sometimes bothersome condition. It's important to distinguish it from a regular scar. Imagine your body's healing crew never clocking out. They just keep working even when the job is done. Collagen, the protein that helps rebuild skin, keeps piling up, even after the wound is closed, leading to this excessive scar formation. Unlike regular scars, which typically stay within the boundaries of the original wound, keloids grow beyond the original injury, invading surrounding healthy skin. This is a key characteristic that sets them apart, often forming shiny, firm, dome-shaped bumps that can be quite prominent and sometimes even uncomfortable. They can be pink, red, or dark brown, varying in color depending on several factors. Depending on your skin tone, making them more or less noticeable, and sometimes feel itchy or tender, causing further discomfort and prompting people to seek treatment. Genetics play a big role. A predisposition can be passed down through families. If your family gets keloids, you're more likely to as well. So, take a look at your family medical history. They're especially common in people with darker skin tones, although anyone can develop them, and usually appear between ages 10 and 30, often during periods of rapid growth and hormonal changes. It's not about poor wound care. Even with the best care, keloids can still form. It's just your body's unique way of healing, a quirk in your individual biological response. Understanding this helps us manage keloids better, allowing us to tailor treatment plans to each individual's specific needs. We're not just fading a scar, we're addressing a complex biological process. We're calming down an overactive healing process, trying to bring it back into balance. So if you have a keloid and you're feeling self-conscious or uncomfortable, know it's not your fault. It's not something you did wrong. It's your body's biology in overdrive, a natural, albeit sometimes unwanted response. Recognizing this is the first step to effective treatment and finding a solution that works for you. Let's dive into why keloids love certain spots, like your ears, which are particularly prone to keloid formation after piercings. Earlobes and ear cartilage are keloid hotspots for a reason. The skin here is tight and stretched, so when it's injured, like with a piercing, your body's repair crew goes into overdrive. Piercings create a chronic, low-grade inflammation, especially with jewelry constantly in place. Cartilage heals slowly, giving keloids more time to form. Everyday activities, sleeping, headphones, phone calls, add friction and pressure, disrupting healing. For those genetically prone, even minor irritation can trigger a keloid. That's why ears are so vulnerable. Knowing this helps you make smarter choices about piercings. Prevention starts with understanding your risks. Spot a new bump after a piercing or injury? Don't panic. Early action helps. Gentle, consistent pressure can flatten a forming keloid. Pressure earrings are a great tool. Silicone gel sheets or ointments hydrate scar tissue and signal your skin to slow down collagen production. Cut silicone sheets to fit and wear them for hours daily. Keep the area clean. No picking, scratching, or harsh chemicals. Mild soap or saline is best. These methods work best on small new keloids and require patience. Results take weeks or months, not days. If the bump keeps growing or gets painful, see a dermatologist. Early gentle care is your best first step. At-home care can be a great starting point for addressing tiny, new keloids. But it's important to know when to call in the pros for more advanced care. If your keloid continues to grow larger and larger, despite your efforts, or if it becomes increasingly painful to the touch, or unbearably itchy, or if the keloid interferes with your daily life and normal activities, it's time to see a dermatologist for a professional opinion. Remember, early treatment is often easier and far more effective in the long run. And don't forget, emotional distress caused by a keloid is also a valid reason to seek help. Your overall well-being truly matters, so prioritize your mental health. Furthermore, if you have a family history of keloids, always consult a dermatologist before getting any new piercings or undergoing any surgical procedures. preventative plans tailored to your specific needs can make a big difference. So, don't wait for things to get significantly worse before seeking help. Seeking expert guidance gives you the best shot at effectively managing and controlling keloids. When it comes to tackling keloids, dermatologists have a comprehensive toolkit at their disposal. They understand that each keloid is unique and requires a tailored approach. They often employ a strategic combination of treatments to achieve the best possible outcome. This multifaceted approach allows them to address the keloid from various angles, maximizing its reduction and minimizing the chances of recurrence. Corticosteroid injections are frequently a first-line option because they work by directly breaking down the excess collagen that forms the keloid, while also significantly reducing inflammation in the affected area. This dual action helps to flatten and soften the keloid. These injections are relatively quick to administer, usually performed every few weeks, allowing for consistent monitoring and adjustment of the treatment plan. With regular treatments, corticosteroid injections can effectively flatten keloids over time, improving their appearance and reducing associated symptoms like itching or pain. For keloids that appear red or vascular, indicating a high concentration of blood vessels, laser therapy is often employed to specifically target these blood vessels, thereby reducing the redness and overall prominence of the keloid. To enhance the effectiveness of the treatment, lasers often work best when used alongside steroid injections, creating a synergistic effect that tackles both the collagen overproduction and the vascular components of the keloid. Surgical removal is typically reserved for particularly stubborn or large keloids, those that haven't responded well to other treatments. However, simply cutting them out without additional measures carries a significant risk of even bigger regrowth, a phenomenon known as recurrence. To mitigate this risk, surgery is almost always paired with other treatments like steroid injections, pressure dressings applied to the site, or even low-dose radiation therapy. The purpose of radiation is to prevent the excessive collagen production that leads to keloid formation in the first place and significantly lowers the chances of the keloid recurring after surgical removal. Ultimately, combination therapy, utilizing multiple treatment modalities, offers the best and most sustainable long-term results in managing keloids. It's important to remember that every case of keloid formation is unique, with variations in size, location, and individual patient factors. Therefore, your dermatologist will carefully assess your specific situation and tailor a personalized treatment plan to address your individual needs and concerns. The primary goal is to effectively shrink the keloid, alleviate any associated symptoms, and most importantly, keep it from coming back in the future. Prevention is key, especially when it comes to keloid formation. Understanding how to minimize your risk is the first and most important step, especially if you're prone to keloids. This predisposition can be genetic, so knowing your family history is crucial. If keloids run in your family, extra vigilance is needed. Before getting a piercing, consider the potential risks involved. Weigh the risks carefully. Think about the location of the piercing and how likely it is to be irritated or injured, and choose a skilled professional. Look for someone with extensive experience and a solid reputation, who uses a sterile needle, not a gun. Piercing guns can cause more trauma to the skin, increasing the risk of keloid development. Pick high-quality jewelry, like titanium or gold, to avoid irritation. These materials are less likely to cause an allergic reaction, which can inflame the piercing site. Start with a simple stud, not a hoop, at least initially, to minimize movement and friction. Excessive movement can disrupt the healing process and increase the likelihood of keloids. Clean new piercings with saline twice a day. Avoid overcleaning, which can dry out the skin, and don't twist the jewelry, as this can introduce bacteria. Keep pressure off the area. Be mindful when sleeping or using headphones. Pressure can irritate the piercing and hinder healing. At the first sign of a bump, indicating potential keloid formation, act quickly. Use silicone gel or pressure discs. These can help flatten and soften early keloids. For other wounds, such as cuts or surgical incisions, proper care is essential. Keep them clean and moist with a sterile bandage and appropriate ointment. Then use silicone sheets once healed to help minimize scarring. Proactive care, including consistent wound management, can prevent keloids before they start. Stay informed about keloid prevention and take control of your healing process. Knowledge is power, Small steps, consistently applied, make a big difference in preventing keloid formation. Let's clear up some keloid myths. Keloids aren't contagious or cancerous. They're just your body's unique healing response. You can't scrub them away or rely on miracle creams. Aggressive treatment only makes things worse. Effective management takes time and proven methods. Having a keloid doesn't mean you must avoid all surgeries or piercings forever. Just be cautious and proactive. Work with your doctor for a prevention plan if you need surgery. Keloids aren't untreatable. There are many options, from injections to lasers. Don't lose hope. You have choices. Consult a board-certified dermatologist for guidance. The right plan can make a real difference. You're not alone in this. We're here to help you manage and move forward.